We'll just wait for like two attendees and then we'll start.
Seven o'clock isn't so popular tonight.
Yeah, I guess. I never had this happen. Like I have had, well, there's someone in the healthy hours. Sometimes there's like, oh, one or yeah.
Hello.
I guess we can get started. Okay, well. So welcome everyone. We are so happy to have you here tonight. Thank you so much for joining. We know it's a little bit rough with the weather and the time now getting darker a little bit earlier, but we'd like to welcome you to this webinar. We hope that you learn a couple of tips and things that are going to help you to have a healthier year. As you know, RPM Logix is partnered with your physicians, and we are here to provide services. And our mission is to educate, coach, and motivate everyone to live healthier lives. So you are all members of our program, and that gives you access to our nurses, registered dietitians, and diabetes educators. So if you would like to connect to one of them or to start working or using some of those services, please just let us know. You can send us an email or give us a call where you receive the invite for this webinar at the end. Then there's our email. You can use that to connect with us and then start working one-on-one with some of our healthcare providers. And yeah, just wanted to welcome you. This webinar will run for about 30 minutes, and then we will have questions at the end. The questions will come from you. And the way that this works is you can, if you look at the screen on the Zoom site, you can just look at the Q&A box, and there you can click there and then type your questions, and then we will be happy to answer them at the end of the presentation. And and today our presenter is Terri. She is one of our diabetes educators here at RPM Logix. She also has a background in exercise science and then in many other things that she will tell you about. She also has a beautiful family that she loves to spend time with and go to the beach and do like outdoor activities. So I would like to welcome Terri too and give the mic to her so she can get started with the presentation tonight.
Hi, I want to welcome everyone. Today, I'm really excited to talk about this topic, Refresh 2024, kind of helping us know how to set goals. I'm going to talk about what that means, and we're going to talk a little bit about New Year's resolutions, and we're going to get into a little bit of that. But before we get going, just to tell you a little bit about me, some of you who do not work with me, these are a little bit of my background. So I am a national board certified health and wellness coach, as well as an exercise physiologist, an obesity specialist, and also a sports nutritionist, and then a certified diabetes care and education specialist. So a little bit of everything. I think it really helps when you're trying to help someone being able to kind of reach in all corners. So that's a little bit about me. And Abigail already shared with you that one thing I do is I love the beach. That is one of the places I'm always trying to get to. If anyone knows me, I'm always trying to find one. So I'm 3 hours from one, but still I try. Also I love animals, and there's my dog Howie, and he's 11, but he acts like a puppy, literally. So I love hanging out with him, and we keep our family very active. So I try to practice what I preach. Love dancing in the kitchen, making sure, the family's active, and traveling and listening to music. So that's a little bit about me, and before we get into the good stuff here. So one of the quotes that I wanted to show is, if you fell down yesterday, stand up today. So I think it's really important when we're talking about goal setting. We're talking about New Year's resolutions, and goal setting is a part of our New Year's resolutions. We're going to get into that later. But you think about it, if you fell down yesterday, you will stand up today. you know? And it's like that with our goals. If we, let's say we're not able to hit our New Year's resolution or we're setting goals and we're not able to, we, can pick up and start again. So just always keeping this mantra, I think is really, really important. So, how many people have set New Year's resolution goals? So those that are here or even watching, right? That's because it's going to be recorded too. Kind of think in your head right now. How many people do you think, if we're looking at United States, how many people do you think actually set New Year's resolutions? And we'll be talking about what your New Year's resolutions is shortly. So 37% of Americans said they had a goal or resolution they wanted to achieve in 2023. Obviously, we're not in 2020. We don't have data for 2024. We're barely in there. 87% saying they're very or somewhat likely to keep it through the year. So Forbes, this is where I got a lot of this information. It was really interesting. They did so much research on learning like what New Year's resolutions are, how are people successful, and that's what we're going to focus on later. And kind of talking about maybe what, can cause us to maybe not be able to stick with those goals too. So, what goals do you think are the most common? So, let's just take a minute and let's think about what do you think the most common New Year's resolutions are? And you might be biased, right? You're thinking of you, obviously, because you're the one that's setting them. So thinking about what your New Year's resolutions goal would be. I bet a lot of you might already think about the top one. So most common goals, as a lot of people talk about the gyms. Gyms right now are very, very full. Lots of people are setting their goals to not only lose weight, but they use the gym for improved fitness and improve diet, and improve finances, improve mental health, traveling, meditating more. This is more of the mental health side of things, drinking less alcohol or performing better at work. So those are the most common goals. And as you can see, a lot of them are tied around that weight loss component. If you're trying to lose weight, a lot of times you are going to be working on your diet and you're going to be working on your exercise. So how many people are successful with their New Year's resolution goals? If you could guess. And I'm so sorry, I'm about to sneeze, but it's not coming out. So I apologize if you hear me sniffling. So think about it. New Year's resolutions for some people is something that they just do. They just, it's January 1st. Let's just pick something. And think even to yourself, like how successful are you? With your New Year's resolutions. And I don't want to focus on the fact that so many people fail because what would be the point of doing this presentation? We're going to talk about ways to make your goals more successful and how to be able to stick with them with some simple tips. So, how many people are successful with their New Year's resolutions? What do you think? 9% of Americans complete their New Year's resolutions. 23% of people quit their New Year's resolutions by the end of the first week. So if you're here and you already have a goal, you are already ahead of the mark here because people have already been quitting, in only the first week. 43% quit at the end of January. So if you hold on and you make it through January, you're also really ahead of the mark here. So in total, though, 9% of Americans actually complete their New Year's resolutions. So that's something to just kind of keep in mind. It's a celebration, right? You get past the first week in January. It's a celebration. You get past January. And I thought this was so interesting. So in fact, failing at New Year's resolutions is so common. There's actually a slew of unofficial dates commemorating such failures. Okay, so they basically call it Ditch New Year's Resolutions Day. I had never heard of this before, but they're saying that January 17th is kind of that day where everyone tries to ditch their New Year's resolution. So I'm really curious if anyone here is thinking, if that date has any significance, or if you find yourself that's kind of like the three week marker where you kind of feel like you're falling off a little bit. And so actually, one of the other ways it might not just be January 17th, it's the second Friday in January as Quitter's Day. So that's coming up here, Friday. Have you set your New Year's resolutions? Is that something that you do? Is that something that you think about? And what exactly is New Year's resolutions? It's just a new year. And so now it's time to set some goals to try to improve in some area of your life. So think about us here today. Think about your New Year's resolutions. We are already 9 days in and you're still here. And how do we not become that statistic? We kind of think it's possible to do. It really is. And there's just some steps that we're going to walk through to kind of help you with that. So let me show you how. But first, let's think about what your current New Year's resolutions are. One thing, if you are in this webinar, if you want to grab a piece of paper, you can, and a pen. We're going to talk a little bit about, structuring your goals, and you can do that if you like. If not, it's fine. But I always just like to say, if you have paper and pen, or even wherever you are. All right, so what are your goals? So this is a great opportunity to really hone in on what your goal is. So think about what your goal is while we walk through these steps on how to make your goals more successful. So I like to look at these as steps for success. I know we talked a lot about, failures, right? Lots of people fail, but we really, really want to focus on how can we change that? So this first step is, what is your why? So this is where you really sit back and you set goals that are meaningful to you. So these goals, a lot of people, you might set a goal because maybe your family member is, or maybe a friend is, or maybe the neighbor is. And you think, oh, or maybe your doctor said, you need to set this goal. We want to have some connection to the goal. That's the first step here. So we want to set goals that are meaningful, not just because of a calendar change. Goals should be based on a need, your need, what is important to you. So you want to always ask yourself, why do these goals matter? Why is this important to me? And really sit down and think about it. So ask yourself this, why do you want to be healthier? Why is it important to you? Is it to be around your family? Is it to maybe, be around grandkids? Is it actually one of the things I've talked to patients is being able to get up off the floor easier. Like if you're down playing with grandkids and you need to get up, having less pain in your joints, being more mobile, being able to be around friends and family. There's so many different reasons, and everyone's reason is different. So really sit down and make these goals personal. So ask yourself, what is my why? The next part, this is our step 1. Step 2, some of these, just so you know, you don't have to go in order 1 through 10, but I just find this is a good flow. So step 2, we want to visualize our goals. We want to imagine your future best self. Think about what this would look like. So really, really sit down and really think about it. Create feeling and purpose in what you write. So for example, I see myself, let's say you want to lose 20 pounds. Okay, what does that look like? What does that feel like to you? So you could say, I see myself being 20 pounds lighter. I feel less pressure in my joints. I feel healthier. I have more energy. I'm able to do more things that I want to do. I'm able, to walk to the bus stop better. I'm not out of breath when I walk up and down the stairs. So, kind of putting this together so you create that connection again. So you're not only making your why, but then you're visualizing what that goal is. So now here's the other one. Are you ready to change? Is your goal, are you at the point when you're making these goals where you actually are ready? Wanting and ready are different. So this is really going to help you if you determine, what's realistic to you. Sit back and think, what's realistic in my life? Is this, am I ready to change right now? One of the things to figure that out is to write a pros and cons list. So all that means is you think of the positive things if you change, and you think of the negative things that you change. And then you see like which part of the list is longer, and that can help you figure out, where you are in that change scale. So pretty much you can ask yourself, 10, I'm 100% ready to change, 1, 0, not at all. So if you're anywhere between that, 7, 8, 9, 10 range, you're more in that line that you're ready to change. If you're not there, we try to restructure the goals a little bit to get you to where that goal is, where your change level is. So we want to anticipate challenges and barriers. We want to prepare for them. So having a positive attitude is essential, but you also have to prepare if there's a challenge. So I like to look at this as kind of having a backup plan. So for those who work with me, one of the things that I talk a lot about is in the wintertime when we want to increase our exercise. We want to walk. We love walking outside. And so what happens when you set a goal that I'm going to walk 30 minutes, 3 days a week? And then the weather, I don't know where you are now. We have wind warnings, we have flood warnings, we have snow, we have all these different warnings. So you got to be safe. So what do you do, if you can't do that? So you have to come up with a backup plan, maybe exercising in your house, different things that you can do. So just making sure that you kind of prepare for maybe possible challenges. You cannot always plan, right? It's not perfect, but we want to kind of think of that in our head. Accountability. People who write down their goals are actually 2 times more successful in achieving their goals than those who don't. So writing down, so it helps you from an accountability standpoint because you're actually tracking what you're doing, but also accountability, you tell a friend. You can join an accountability group. They have a lot of them, online. Use something to track your progress. There's apps, there's your notebook, whatever you need to do. And this is just another component to help you with being more successful in your goals. One other thing is think long term. So think lasting. Okay, so we might be preparing, let's say we want to lose 20 pounds because we want to go to a wedding, or something like that. That is a short term. What do you want to do after you get to the wedding and after you wear what you want to wear? What's that long term? So the goals need to be something you want to implement as a lifestyle change, not just temporary. So really kind of putting a lasting effect will help create that goal and have more purpose and structure. Break down your challenging goals into steps. This is probably one of the biggest ones. You think of a mountain, it's huge, and you look up at this huge mountain. How are you going to get to that top? Right? You got to do a lot of training. You got to do a lot of steps to be able to get to that point. So challenging goals are important. You need something that's going to push you, but you also need to feel like they're not too big to achieve. So we want to set these long-term goals, but we also want to set short-term goals. So let's say you'd like to walk for 30 minutes, 5 days a week. And, we end up talking and you say, all right, tomorrow I'm going to start walking 5 days a week for 30 minutes. And then you say, well, how much walking are you doing now? You say, well, I'm just doing 1 day a week for 10 minutes. So we want to kind of break that up. So basically, if we set too much up front, that kind of can set us up to fail. So we want to make long-term and short-term goals. So our long-term goal, within 3 months, you're walking, 5 days a week for 30 minutes. And our short-term goal is we're building up to that point. And also, as we're going through this, if anyone has any questions, please post in the chat too. The Q&A, sorry. All right, one of the things for your goals is to set smarter goals. I don't know who's heard of this before, but this is a tool that we use for successful goal setting. So there's different components to helping make your goal more successful. This helps you provide an action plan so you know what you're asking yourself to do. This is also a roadmap. So basically, this just gives us a sense of direction and kind of purpose and it's pretty much like a blueprint, like a map when you're setting a goal. And I'll show you what that means. So smarter goals. So when we look at our goal and we're thinking about what we want to do, we want to make it specific. We want to make it measurable. Achievable, it's got to be realistic. It's got to be something that should be challenging, but we can still do it. Time bound. Do you know kind of what your time frame is, what you're going to do? But then you also want to be able to evaluate and step back and look, have some check-ins with yourself, and then be okay with readjusting. It's okay if you have a big goal and it's not working and you've been trying, you can always readjust. It's not giving up. It's just readjusting it so you can get back to where you're trying to get to. So let me give you an example. Let's say you have an example of smarter goals for eating better. So you just say, hey, I want to eat better. That leaves a lot of wiggle room. What exactly do you mean, right? So if we're going to get specific, we would say, I will incorporate more fruits and vegetables into my daily meals. But now we have to add some other components, how many fruits and vegetables? So we're going to measure. You want 5 servings of fruits and vegetables. Is it achievable? You think, yeah, you know what? I can add a piece of fruit to my breakfast. I can include vegetables in my lunch and dinner. That's realistic for me. That's achievable. And then you look at relevant. Is it relevant? You know that eating fruits and vegetables have more vitamins and minerals, so that's important to you. Time bound, meaning, you know how many times per week you're going to do it. I'm going to do it 5 days a week. Then you want to evaluate. So this could be looking at a food diary to track your intake of fruits and vegetables, something that you can look back on to see what you're doing. Then readjust. If you find it too challenging, you can explore different things. Yeah, and there's other options. Just remember, this process does take some time, especially if you've never heard of this before. It's not something that everyone knows and knows how to do. And so, just remember that if you're not too sure about what this is, it just takes some practice. Remember that the key to setting effective goals is to ensure they're aligned with think of your larger objectives. Everything kind of goes along with what your why is, and you tie it all in. So this is just a little template. So this kind of just like a short version to make it just something to think about. So kind of setting your attention. So you can basically say, I will do what? In. So for example, I will walk for 20 minutes at 8 a.m. Monday, Wednesday, Friday, and I'll walk around my block. So the in is you're going to walk around your block and I'll start tomorrow. And then I added, I'll use my Fitness Pal to track my progress. So basically you just get some check-ins to try to kind of keep your goal aligned. Celebrate, celebrate, celebrate. Please celebrate. It's so important to celebrate. I know a lot of people I talk to, if they haven't hit their goal fully, they say there's no point of talking about celebrating. There is. Anything small that you do, celebrate, because that starts building up that positive mindset. We're very critical of ourselves. We have a lot of negative self-talk sometimes. And the way to kind of like I call it tame the inner critic, is to celebrate small things and bring that positivity in, even if it seems small. Let's say you wanted to walk for 5 days and you're like, I only did 2. That's it. That was horrible. No, you did 2. Where were you before? So sometimes it's hard to look at that way, but it really shows that we're making progress, and any progress is progress. Last, one of the final steps here is you can set goals anytime. Does not have to be New Year's, does not have to be, it's anytime you're ready for a change. June 1st, I didn't know this either. That is unofficially known by many as New Year's resolution recommitment day. It gives you a perfect opportunity to really reflect and take stock of where you're and your resolutions, and you can hit that reset. So you can really kind of check in with yourself mid-year and see, where are you at? How are you doing? Do we need to readjust, reevaluate, and celebrating what we accomplished? So this just kind of recaps, what we talked about today. I encourage anyone, if you're really, really, really wanting to set these goals for long term, sometimes people might use like write it on a board or a paper or something and put it in their house so they can see what your big goal is. Sometimes it's like a vision board. They call it wellness vision. Sometimes seeing it is very helpful if you need to kind of be reminded right, of what it is. Some people get discouraged, and you have to just keep digging into what is your why and why do you want to do it. And then we go through each of those steps, visualize your goals, asking yourself if you're ready for change, making sure you plan for those barriers or challenges, accountability, make sure they're lasting, long term. Break down your big goals like that mountain, break them down into smaller steps. Be smarter about your goals and celebrate those small goals, and you can set goals anytime. So remember, aim for progress and not perfection, and be kind to yourself. That's the hardest part, is that we're not as kind to ourselves because we want to seek for perfection. And so we want to always celebrate those small moments. And celebrate a wonderful 2024. I hope this helped as you were trying to set your goals and, on your path of a healthy 2024.
Well, that was a great presentation, Terri. It helps to put things into perspective, and I guess also gives us a better idea on how to plan for the year. And like you said, any day is good to start, not just January 1st. If you didn't kind of like work on coming up with goals on the 1st, you can start today, tomorrow. You can make your list over the weekend and get started on Friday or Saturday. Any day is a good day. So if anyone has questions, please just type them in the Q&A box, and then we will answer them. There is one question right now that says, how can I make sure that I meet my goals when I may not have enough time to accomplish those things?
And that's, time is one of the biggest challenges. I'm sure you've heard everyone say everyone has 24 hours in a day, right? But we all we all are doing different things in our 24 hours. So it might be where you have to sit down and kind of evaluate with your time. What can you accomplish in that time? Maybe you might be trying to achieve too much in that time that you have, and that's okay. So you can break it down maybe a little smaller to kind of work within whatever your time constraints are.
Okay, well, and there's one last question. And if anyone has any other questions, please type them while we answer this last one. And it says, well, if I don't have time, but I want to be healthier in 2024, what will you say that it's the one thing that I could focus or should focus on?
So I know that's hard because, it's you really have to ask yourself, what? There's so many different choices, right? You kind of sit down and what you can do is sit down and write out a couple things. Like, let's say you could say nutrition, you could say exercise, you could say stress, you could say sleep, and just sit down and look at that paper and ask yourself, which one of those things do you want to start with? All those things can impact your health. Those aren't the only things, obviously, but then you can kind of start thinking, okay, maybe I could tackle nutrition, and then what specifically about it, or physical activity. So it's going to come down to you, right? And that's the hardest part. Unfortunately, if we could do it for you, we would. But
Yeah, and I agree. Like, no one can tell you. It all depends on your situation. And something that may help, like it's just like Terri was saying, writing it down on paper, like maybe coming up with drawing like a pie chart, like just a circle, and then dividing it into different portions, and then kind of like putting the percentage of which one you feel like you are most behind that, or that it's like kind of like the weakest link for you. And then maybe that's the one to start with, and say like, okay, maybe if you're not sleeping well, maybe that's the one thing to get started with. And when you have that one that you feel like you have improved, and then you move to the second one and make goals in that area. So it will be different for everyone. But whatever you decide to work on, if you set goals for yourself, you challenge yourself in a way that is realistic and not overwhelming, we are pretty sure that you will have a healthier 2024. And if you would like to work with any of us one-on-one with Terri, myself, we have other dietitians in our teams. Then we also have other diabetes educators and nurses also in our team. So if you would like to work with any of us, send us a message, let us know, and we will be happy to connect with you and then start working with your goals one-on-one. And so we have a webinar every month. So we hope to see you in the next one. You will be receiving invites via email. And then this month, we will have a support group. It is called Healthy Hour, and we will have it on the 24th of January. And you will also receive invites via email if you are in our email list. Just if you got the email for this webinar, then you will also get it for the support group. And we will be happy to have everyone join that one as well. And this webinar is being recorded, so we will put it up tomorrow on our site. So if you would like to review the information or just watch the webinar again, you can ask your nurse or your dietitian to send you the link, and we will be happy to do that. Thanks everyone so much for coming. Have a great night. Thank you for joining on this cold night, and we hope to see you in our next one.
Stay safe,
Terri,
most
for the
importantly.
information.
Bye.
Bye-bye.